All right, all yours, Allison.
Okay, thank you. Good evening, everyone. As Becca said, my name is Allison Guerin, and I'm just going to tell you just a little bit about me. I am going to hold on a second. Let me shrink this down a little bit so I can see. Okay, so I'm just going to tell you a little bit about me. Like Becca said, I do work for a voluntary agency in Western New York that services and supports people with both intellectual and developmental disabilities. I have been in the agency for 29 years. It initially I just started one summer to work there, and I was just going to be doing it as a side job, and 29 years later, here I am. I currently have my master's degree in applied psychology, and I'm in the process of finishing up on my second master's degree in clinical mental health counseling. My main goal is to hopefully be able to provide counseling support and services for this population, people with intellectual and developmental disabilities. I don't know how things are in Florida, but here in New York, there are not a lot of therapists who know how to work and or communicate with people with IDD. So it's difficult for our folks to find avenues to be able to get counseling services. So that's what I ultimately would like to do. When it comes to this field, I have a huge passion for this population. I grew up in the human service field. My father worked in a variety of agencies for a number of years. Each of my siblings are in the human service field in one way or another. And when I was younger, I had several foster brothers who we brought into our home, and we were able to grow to know and grow to love and just be able to be a family for those people. So this population is just a wonderful population for me to serve. What I want to do is I want to just start with talking about what constitutes behavior. You know, when we think about it, everything we do and everything we say is a form of behavior. On here, I have a definition as behavior is defined as how a person acts or reacts in a given situation. It's also how a person may respond to a stimulus and the actions that they display when they're either trying to make that stimulus change or make it stay the same. So in essence, me just talking to you and talking about what I know and what I do is a form of me, a form is me forming a behavior or interacting with you. One thing that we need to know is that every behavior has a function. Now, my function right now for the behavior that I'm displaying is to just give you a few tips and pointers and things that I talk about with the staff and my agency. The function of that is to just give you some guidance. So every behavior has a function. It serves a purpose for that particular person. Ultimately, it's the why the behaviors are happening. What I like to teach the staff in our agency is that there are four major functions of a behavior when we think about it. The four major functions are to escape a behavior, to gain attention, to gain some sort of tangible object, or for sensory input. So with these functions of behavior, we talked about sensory. These are behaviors that are reinforced by a sensory input. So when we think about the sensory aspect of the behavior, we are thinking about our tastes, our feels, the sounds that we hear, the smells that we hear. Oftentimes you may see a person who gets nervous, that they may begin to start rocking or to start pacing, or their breathing might become more rapid. For me, when I become nervous, I tend to speak very, very quickly which is funny because I oftentimes speak quick as it is. So when I become nervous, I become even faster. The second function of behavior would be to escape. These behaviors are displayed to escape a particular task or demand. When you think about escaping a behavior, we often think about um, a person intentionally slowing, like if a supervisor were to ask them to do some to do some additional tasks, and then what the person would do would they would be to drag their feet to get out of doing those tasks. That would be something that would be considered an escape. Or if you think about a child, when you ask a child to set the table or to get ready for their shower or their bath and they run away, that's escaping the task or demand that's being presented to them. Attention. Attention is probably one of the greatest functions of behavior. And this is when behaviors are displayed to get another person to attend to them. So oftentimes we'll see people in not just in the IDD population, but we see people who will sit there and they'll tap on things, or they will if you're in a classroom setting and there's somebody who is drawing attention away from the teacher, they're trying to gain the attention of everyone else. Lastly, we have tangible. These are behaviors displayed to gain access to a particular item. The first thing that comes to my mind when I think of tangible is I think of being in the supermarket, and you're checking out and you're in that checkout line, and what is there? There's all that chocolate and all that candy, and oftentimes we as kids would want to get a piece of candy or something, and our mom would be just like, no, we're having dinner soon, we're not gonna get that right now. Well, what is the first response of us as children? We'll start to cry, we'll start to whine, we'll start to make a fuss. So then ultimately what's going to happen is the mom's going to be like, okay, 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 here you go, and give that item to the child to just quiet the situation, because now everyone is looking at them. So that would be something that's tangible. One of also the most important things that we need to try and remember when it comes to functions of behavior is that we always probably need to think about the medical aspects first. Oftentimes in the IDD population, some of our folks are not able to communicate that something is going wrong. If they're not feeling well, if they're having some pain of some sorts, we need to make sure that we rule out those medical things first. I know just one example of my years of service is that we had a gentleman who was a nonverbal gentleman, and oftentimes when he would have difficulties and his behavior would begin to escalate, we would later find out that he had an earache or a toothache, but he was unable to tell us. So the way that he was explaining that he was in distress was through the display of his behavior. So, why do challenging behaviors occur? Oftentimes, this is a form of communication. The person is trying to express and to communicate an unmet want or need. There's something that they're not able to let you know. So this is how they let you know that something's wrong. When we think about the IDD population, the person's disability may also play a huge role in their challenging behavior. Because so often people with IDD are misunderstood. They don't, there's also different forms of other developmental disabilities that could contribute to those challenging behaviors. And we'll talk a little bit more about that a little bit later. Challenging behaviors are often seen as necessary for the person. And when we think about that, we need to start thinking of, instead of asking, why are you doing this? We need to explore what's going on in the person's environment and their surroundings, and try to look at it and examine what has changed in the person's environment. And a lot of times these things may be related to internal or external factors in their life. So continuing on that, we're looking at those internal or external factors. When we think of internal factors, we're often thinking about those factors that occur inside the body. And most often that's medical. It's not always medical, but a lot of times it is medical. So we're thinking about does the person have any type of pain, a headache, a stomach ache, maybe they have a toothache, any kind of pain that would occur inside the body. Is the person hungry? Are they thirsty? How long has it been since they've had something to eat? Grief. Oftentimes grief is another internal antecedent or factor that could cause challenging behaviors to occur. Through my job, I'd also do some grief work with our folks because they're not able to fully express how they're feeling when they have a loss of a loved one. So I like to go in and I like to talk to them and get to know the person and navigate some of those things that are causing them to have such distress. Frustration. Frustration is a big one. Loneliness. Even though we try to do as much as we can to support our loved ones and care for those that have our intellectual disabilities, oftentimes there's loneliness because they have their lives are so different. They see their lives as different from everyone else's. Fear is another thing that could cause some distress in a person. And then trauma. We need to think about some of those things that we'll talk about later as far as that are related to their disability itself. We also have some external factors, and those are the things that occur outside the body. So we need to think about the environment, right? So temperature, is it too hot? Is it too cold? That could also serve as something that could be like challenging for a person. Noise and crowding. I don't know about a lot of you, but for me, if it's really loud and it's really noisy, I will often withdraw. And if I will often, take solace somewhere else because I don't like a lot of noise. And we're no different than our loved ones who have a disability where those kind of things affect them as well. A change in or a lack of routine. If someone is used to things being done a certain way, a change in that, just the smallest change in that without knowing that change is going to happen could cause distress. Being threatened. If you think about it, many times people with disabilities often look different to the outside public. They often act different to the outside public. So there may be bullying going on. So they may be being threatened. They may be called names. And then there's also, lastly, getting caught doing something they shouldn't be doing. I mean, that happens so often in each of our lives, I can imagine. Right now, we're just going to transition and just talk, we talked about those disability specific things that could occur in a person's life earlier. And I just want to just briefly touch on some of the other developmental disabilities. There's intellectual disability, of course. There's also Down syndrome, cerebral palsy, attention deficit hyperactivity disorder, or also known as ADHD, autism spectrum disorder. There's also those other symptoms of Fragile X syndrome, fetal alcohol syndrome. These are all epilepsy. These are all things that are other disabilities that there's things in their lives that could play a role in them. Okay. So now we're just going to look at some characteristics related to IDD that may lead to those challenging behaviors. Right here we have, there's sensory motor development, communication deficits, cognitive processing, social development, emotional dysregulation, and limited self-direction. I'm just going to, oops, I'm jumping ahead here. I don't know how to go back, but see, how do I go back? I'm sorry. I'm going to pause my sharing really quick. Mm.
I think if you press the back arrow on your keyboard, it might go back.
Yeah, no, it didn't do that.
Hmm.
Oh, wait a second. Here it is. Here it is. Woohoo! All right. All right, my sharing is paused, so let's unpause. Right there. Oh, now I'm gone. Do you see my screen still?
Yes, but it's not in slideshow mode. There you
There we
go.
go. Okay, thank you. Sorry about that. Okay, let's see where we're going to go back. We're going to talk about the sensory motor development. When we think about sensory motor development, there are things that are just where a person may have experienced disturbances in any of their senses, right? There could be hearing deficits, there could be seeing visual deficits, there could be deficits in um disturbances in their motor skills, things like that. So those are a lot of challenges. Could be with if you think about people with CP, cerebral palsy, those they could have deficits in that. Communication deficits. Communication is often very, very difficult for our folks. Okay, there might be some, I can think there could be difficulty organizing their thoughts or articulating their words. Oftentimes our folks might have some limited or poor verbal skills. And if they're nonverbal, they may not know typical manual signs. They may have their own signs that other people may not understand. So they're having a difficulty with limited ways to communicate with others. There may be difficulty finding words or knowing the correct words to say when they're trying to explain themselves. There's also a stereotype that many people with IDD, they have perseverative language where all they can do is just talk about certain things and then just keep repeating themselves over and over. There are also deficits with not always understanding those cues of other people and figuring out what they're trying to say or trying to do. So those there's deficits where they're not able to provide the other person with accurate wording or things of that nature. Then there's also cognitive processing difficulties where the person could be easily distracted. Comprehension concerns often arise because they're not able to understand what you're trying to tell them. They're also um, inattention to tasks or activities, or when you ask them to do something, they're just doing it because you ask them to, and they're not able to attend to exactly what you want them to happen. There's also memory difficulties. Oftentimes our folks are this especially happens with when you're asking them to do a task, or asking someone to take a shower. Okay, why don't you go and get your towel, get your pajamas, and meet me in the bathroom. Oftentimes, the last thing they hear is meet me in the bathroom, and that's the thing they do. So they're not able to follow those directions with you if you do those 2, 3, 4 step directions. Limited problem solving skills or decision making skills. Oftentimes it's hard for them to understand what they're supposed to be doing next. And then impulsivity is huge because sometimes when a person starts to get frustrated, they just react instead of being able to think about what they're doing before they do it. Social development is a big one. um because the person because of their disability and being part of the IDD population, there's those negative social conditions that they've experienced because of their disability. Oftentimes there's labeling. This is a stigmatism that, I mean, I'm sure we all have heard labels of people that we support and people that we love because of their disability. You know, they're thought of as being not normal. And who's to say these days what normal is, you know, and it's just a hard and difficult thing to see. Rejection and social disruption because of their disability, they often face rejection because of their disability. They're often neglected by others in the community because they're different. They're seen as different. And so often this is just something that could be just so harmful. Um, you know, when we think about social development, we also think about segregation. Like you know, you think about how olden days is not as much today, but in the past, you'd think about there's always that special ed room, right? Where the kids that have special needs go, you know. Um, there's not always the inclusion factor. A big thing now is inclusion and trying to help our folks live and engage in a normal everyday life in their communities. Restricted opportunities. How often do we hear that they're not given the same opportunities to be able to live a fulfilled and fulfilled life, you know, get out into the workforce and do the same thing as everybody else. You know, it's something that unfortunately occurs because people don't feel that they have the knowledge or the know-how or the ability to complete the job at hand. Victimization. You know, people often think that because a person has a disability that they're not smart. You know, they oftentimes will take advantage because they don't think that they know, you know, like I just think about a time where I was with someone when we went to a baseball game and we were sitting there and we were going up and the person was so excited because they're learning their money management skills and they're going up to on their own to buy their piece of pizza. And the person who was taking care of them or working at the counter saw that they had a disability and tried to take advantage of that. So they charged them an extra amount of money because they didn't think they knew any better. You know, there are situations like that that I absolutely love when they're just like, no, that's not what the sign says. This is what it says. And they're able to say back to the person that they're wrong. But so oftentimes some of our folks are not able to do that. And then infantilization. This is when because a person has a disability, they're treated as a child. Or if they're an adult, they're treated as a child. Or they're you know, there's always that, you know, that person who's like, oh, look at the kids when they're all 40-year-old adults. You know, so infantilization, being treated as a person who's younger than they are. Emotional dysregulation. You know, there's you have a poor person has a poor or negative view of oneself, which could lead to depression, low frustration tolerance, or overly intense emotions. Those both can lead to increased anxiety. Inability to self-regulate. They're not able to help themselves to regulate their emotions or things like that. Trouble making decisions. Oftentimes, our folks might not know what to do, you know, so they look to you, they look to others for support, and sometimes there's just not that a support system. And then expectations of failure. Oftentimes, there's so many of our folks who feel that they're not going to amount to anything because of their disability. And you know, these are some of the things that we are there to support and help and bolster those folks because they can do so much more than they're being told by the outside world that they can do. So what can we do when it comes to emotional dysregulation? And you know, very often people display challenging behaviors because they lack the skills necessary to self-regulate on their own. They sometimes struggle to cope with their emotions in an appropriate way. This often leads to a negative behavior. Oftentimes, this will become frustrating for the person because they just can't let you know what they're feeling. and why they're feeling that way. So with self-regulation, we play a big role in helping to teach this process. We're able to maybe talk to the person, and there's things out there like the emotion wheel, where you let the person know that, okay, this is the color system, and these are what these words mean. Tell me what you feel. There's also I oftentimes I will use the emotion zones, which is red, yellow, green, and blue, and each of those means something different. Blue means I'm sad. I mean, I'm not I'm not sure exactly, but I'm just giving an example that, blue means I'm sad. So let me know, what are you feeling? Helping that person to figure it out on their own. There's also, if this person is feeling angry or they're upset or they're frustrated, you can use those, asking them, where in your body do you feel it? So, okay, so if I feel it in my chest, what does your chest feel like? It feels like it's on fire. So then helping them to do some strategies of coping strategies to help them to bring that back down, so they're not feeling so frustrated in the moment. Help them to try and label their emotions. I see that you're frustrated. Tell me about that. What are you feeling? Even if the emotion is negative, let them give a name to it. I'm angry. I'm mad. I want to scream. Let them get that out so that it doesn't build up and then grow into something more. When you acknowledge how that person feels, you're validating them. You validate that you understand. You understand what they're going through. You're right there with them. You're listening to them. You're actively paying attention to what they're trying to tell you. And then you also want to make sure that we're having that constructive discussion with them to try and address those emotions. Listen. A big thing is just listening to what they're telling you and showing you. Oftentimes we find that our that when we talk to people, we're not always listening. We're telling them what we want them to do, but are we listening to what they're saying back? And we want to make sure that we're not missing those signs, especially when the person is nonverbal. Oftentimes you could see it in their face, you could see it in their eyes, in the way that their face moves or crinkles up when they're frustrated. How does their body tense up? What are they showing on their face? Are they showing that they're getting a little bit red and frustrated? Or are they showing that they're tensing their body to show you that they're not liking what you have to say? Limited self-direction. There's difficulty establishing routines. They don't have the proper tools to be able to establish those routines. Difficulty making plans. There's difficulty dealing with change. Change for our folks is a really, really big thing. It at times can be a really big trigger. There's times that like you tell them, okay, we're gonna go here, and then all of a sudden something changes that you're not able to do that. So instead of explaining it, we're just telling them, no, we're not gonna go. So we want to make sure that we're helping them through that. Difficulty deviating from their routines. So transition times, when they're used to things being a certain way and that changes. So what can we do? Okay, many people do better when there's a structured routine, and they often struggle with transition. So if there's a time of transition, we want to make sure that we're letting them know ahead of time, because transitions are often a difficult thing because no one likes change. And that is even more frustrating when you're not sure why it happened, or you're not sure that it is going to happen. Assisting the person with establishing a schedule. So, writing out a daily routine of what they would like to do. Being proactive with that, letting them know, okay, we're going to get up at this time, we're going to eat breakfast at this time. and we're gonna, and go from there throughout their day. A weekly routine. Do they go to day program? Do they go to work? You know, making sure that we set that up for them as well so that they're aware of these things. If there's an appointment that pops up during that week, making sure that they're aware on their routine that, okay, we're not going to go to work that day, but we're going to go to the doctor's, but we'll go to work the next day. And then a monthly routine. Creating a daily schedule to follow is always helpful. Not only for this population, but I can honestly tell you that I need to create a daily schedule for myself to keep myself on task. Making sure that we're preparing those calendar of events. Oftentimes I find that our folks are looking forward to something and they want to do something, but if they have it on a calendar and they can see that it's going to come to fruition, that it helps to alleviate that anxiety that may creep up when that time is coming. Want to make sure that we prepare the person for a transition that's about to happen. An example that was used previously was that in 10 minutes, we're going to need to get ready to go to work, program, or school, and then providing another warning just before that transition is going to happen. So just not spring it on them like, okay, let's go, it's time to go. Especially if a person has difficulty processing those things and processing those changes. You want to offer choices. Do you want to do this first or this first? So here I put, do you want to take a shower or brush your teeth? So we want to make sure that we're offering those choices. It's not going to be this, or this. There's two choices that you need to choose from, okay? So, and then when you empower people to do things on their own like this, and they're given, people feel empowered when they're given those choices, when they're giving the chance to decide instead of being told what to do. Now we're going to segue a little bit into some of the challenging behaviors that we might see. So when we think of behavioral challenges, often things that come to mind is aggression, right? So aggression comes in two forms. There's either verbal aggression or physical aggression. Physical aggression is a behavior that is displayed that is intentionally going to cause harm, to threaten or to cause harm to another person. This comes in the forms of hitting, kicking, pushing, pinching, biting, things of that nature. Verbal aggression is defined as deliberately harming a person in a verbal or nonverbal manner, using your words. So it could be swearing at someone, name calling, threatening another person, giving them the finger, giving them some not so nice signs, bullying the person. Those are forms of aggression. Then we have disruptive type behaviors. When we think of disruptive type behaviors, these are behaviors that are displayed to that are inappropriate, and they interfere with what's going on in the environment. So, you know, we go back to the situation of the child in the classroom. They're purposely trying to get the attention of those around them by being disruptive. So other disruptive behaviors could be spitting either at a person or on the floor. It could be throwing items, giving those threatening glances. Again, bullying is one of those things that could also be considered disruptive. Non-compliance, just intentionally not doing what you're being asked to do. Yelling, being loud, trying to gain the attention, slamming objects, slamming doors, pounding on tables. These are all things that could be considered disruptive. Self-injurious type behaviors are those behaviors that are intended to harm oneself. So that could be pinching yourself, hitting yourself, biting yourself, head banging, self-scratching. So these are things that would be done to cause harm to you. Destructive type behaviors, there's physical type of destruction, which would be breaking items and throwing things. But then there's also destructive type behaviors, how when it comes to, if you're lying to someone, that could destroy a relationship. If you're refusing to listen to someone, that could be destructive in a way that you're trying to fracture that relationship that you have with a person as well. And there's also self-destructive behaviors, isolation, withdrawing from the activity or from a group, which that could lead to depressive type tendencies. Intentionally refusing to acknowledge someone, intentionally refusing to do something that you're being asked to do, or also ignoring one's medical needs, uh, refusing to go to appointments, refusing to take your medication if you have medication prescribed, refusing to complete hygiene tasks, refusing to complete activities of daily living. These are all things that could be self-destructive. And then we have what I labeled early warning signs. A lot of times people will want to think that early warning signs should be ahead of all the other behavioral concerns. I like to put them at the end because these are things that I want you to think of first. So when I talked about earlier, you think about the last thing that the person said first. So this is where I was going with that. We want to think about those early warning signs. Those are those precursor things that a person might display to alert you that something might be wrong. It could be an escalation in their tone of voice. It could be a withdrawing that normally they're a normal interactive person and they withdraw from the group. There could be a change in the person's eating habits. Normally they have a really healthy and healthy appetite, or and then they suddenly stop eating, or they stop they have just a subdued appetite, or normally they just have a regular appetite, and then they start to overindulge. That could be a changes in their engagement. Are they usually a creative person? Are they usually outgoing? Are they usually the life of the party, and all of a sudden they're not? Or changes in their emotions. Are they crying often? Do they become angry often? So these are all little early warning signs that a person might see to signal that there's something wrong. And those are the things that we should be looking for to identify that something more may happen. So now I just want to really just quickly talk about some strategies that we could utilize prior to a challenging behavior occurring. When we think about when we think about going out and doing something and we're not sure what's going to be happening, we want to be aware of what's going on around you. Does your loved one or the person that you're taking care of, do they like crowded environments? And if you're going to go to a crowded environment, just be aware that maybe they may need their headphones, or maybe they may need their phone or their tablet to keep them busy. So we want to be aware of what's going on around us. We also want to make sure that we know ourselves. We know what to do. I'm sure we've all worked with people who have disabilities, or loved ones that have disabilities. We want to know yourselves. We know what to do. We want to remain calm, because if you're not calm when you're interacting with this person or that person, that could escalate the other person as well. We want to make sure that we're utilizing a calm and neutral tone. We want to make sure we're modeling what we want to see. I work with a young lady who oftentimes she'll start to yell, and she'll start to cry, and she'll start to get escalated, and her tone of voice goes up. When I sit with her and I talk with her, and I'm like, okay, share with me what's going on with you. And she'll just continue to scream and to yell, and I'll look at her and I'm like, I'm sorry, but I really can't understand you when you're screaming and crying. And I'll just keep that calm and neutral tone with her. And before I know it, her level and her tone start to come down to match mine. So it's nice because I'm modeling what I want to see. And then we're able to have that conversation, and she's able to tell me what is bothering her. Be proactive. Offer those choices. If you can, stick to a routine. We talked about it earlier, how routines are often beneficial. And if we're gonna transition from that routine, make sure that we're making that person aware what's gonna happen, that the change is gonna happen. Establish our boundaries. Make sure that the person knows that you are that sorry, I'm trying to, I forgot what I was going to say. Make sure the person is aware of where you stand on certain situations. Um, and that no matter what, they can come to you, but you need to make sure that you're not going into like the little nooks and crannies of maybe getting into that infantilization stage where you're starting, because maybe starting to treat the person like a child if they're an adult. So you want to make sure that you establish those boundaries. We also want to make sure that we're consistent in our approach. If we fluctuate on if we're wishy-washy and we fluctuate on what we're doing and what we're saying, it may confuse the person and they may not know what to expect. So we want to make sure that we're making our expectations clear and reasonable. Is it something that that person is going to be able to reasonably do? And then we also need to make sure that we allow that time for that person to process those thoughts, and process that information. Because sometimes if we're rapid firing different things towards a person and expecting them to understand, we forget about that processing delay that there may be, or those cognitive delays that may be going on. And we want to make sure that we're keeping that in mind, that, okay, I need to slow down a little bit. And we want to make sure that we're promoting understanding. If able, ask the person to repeat back what you said, so that you're able to see and know that they're understanding what you're saying to them. So some strategies that we could utilize if a challenging behavior begins to escalate: first and foremost, remain calm. Because like I said earlier, if you become escalated, then the person might become escalated, and then the whole situation then becomes escalated. Take a few deep breaths. It's okay. Encourage the person to do the same. Offer and assist the person with engaging in a preferred activity. Let them know that I see that you're struggling right now. Why don't we, play feelings Uno? Or why don't we play a game? Or why don't you sit on your tablet and listen to YouTube, or listen to your music? So support the person and help them to name and identify what they're feeling. I mentioned feelings Uno. Oftentimes, I'll play feelings Uno with someone, and we'll sit down and the red means that I'm angry. And if the red card comes up, okay, tell me what you're feeling right now. What is something that makes you angry? And so then to help them identify what those feelings are. When it comes to the challenging behavior, try to not give in, because giving in may reinforce that behavior, which then becomes a negative reinforcement. And if we have a negative reinforcement, now all of a sudden the person's being like, okay, so if I do this again, I'm going to get the same results. So that may encourage the person to display that behavior more often. If you're utilizing consequences, make sure that the consequences fit the behavior. So, that those consequences are something that's immediate. Because if you say, well, if you continue to do this, you're not going to the fair next week. By time the fair comes along, they're not going to remember the behavior. They're not going to remember the behavior that they displayed a week ago. And they're not going to understand why they can't go to the fair today because something happens. So oftentimes we'll make sure that if there's a consequence being made, okay, so that's going to happen for like maybe the outing for today or the activity for today, because they're not going to understand why the activity for next week can't happen when it comes to next week. Pick your battles. Not everything is as big as it seems. So you want to make sure that those small little things, that we're not getting frustrated at those small little things. And one thing that it can happen is if a person is doing a behavior just to get your attention or just to annoy you, like somebody sitting there tapping. I'm not gonna pay attention to the tapping. I'm gonna still acknowledge that person, but I'm not gonna pay attention to that. I'm not gonna draw attention to that behavior. Because if I draw attention to that behavior, they know that they've gotten the response they want. Okay, so minimize your attention to the behavior, but not the person, because when you're ignoring, when you're not, when you're minimizing your attention to the person, then that could lead to that person withdrawing, and we want to be careful that not have that happen. We want to make sure that we're seeking out additional help if the behavior is not improving. Talking to your physicians, talking to a psychiatrist if need be, talking to the care coordinator, talking to maybe family members who can help out. Maybe having the person see a counselor, things like that, getting additional support. Some strategies to avoid that could lead to further behavior escalation. So when you think about it, if you're intentionally or unintentionally planning the suggestion of a challenging behavior, you better not do that. You better, if a person is, if you're going out into the community or you're going out or you're going to a family member's house or you're doing something, you better not hit or kick anyone. Now, all of a sudden you've just planted that idea that while I'm out, I'm going to hit or kick someone. So making sure that we're not going to intentionally or unintentionally plant those suggestions. We want to make sure that we're not going to threaten the consequences of that behavior. I mean, I don't know if this happened to you, but when I was younger, we always heard, if you don't stop that, you're going to get it when your father comes home. So you don't want to threaten those consequences. Sometimes if it's something that works for you, then, utilize that. And you want to make sure that you utilize whatever works for you. But if it's something that, if you're threatened to say, well, you're not going to go here later, if you continue to do that. Or if they have a rewards program, well, you're not going to get that sticker if you still continue to act this way. If the person thinks that they're not going to get what they're intending to get, the behavior will probably continue. Yelling at or belittling the person in front of others. This can be something that could be damaging to the person. We already talked about some of those aspects of disabilities that were the negative aspects of disabilities that people think about others with disabilities. So if you yell or belittle the person in front of others, it just reinforces those negative feelings of having a disability. Another one is demanding emotionally difficult actions from the person. I don't know about you, but if I'm upset and someone tells me to calm down, that's the last thing that I'm going to do. Because if I were able to calm down on my own, I would. So that would just oftentimes frustrate me even more if someone's telling me to calm down. So at the moment that this behavior is occurring, calming down is probably the last thing on the person's mind. And if they were able to, they would, but right now they're not. So they need a little bit more than someone just telling them to calm down. So that's the emotionally difficult action that you're asking them to do. Forcing the person to apologize. Now, we were all raised in families that, we were taught that if you hurt someone's feelings, that we need to apologize. This is something that is 100% able to be encouraged, but demanding a person to apologize for something that they're not sorry for, I don't know about you again, but I can honestly say that I am not always sorry for some of the things that I do or say. And so it would just be something that is an empty apology. Okay. Rehashing the incident in front or the behavior in front of the person. This is just basically talking about the person as if they're not there. Making them feel less than because you're talking about them in front of them. So you want to be careful to not do that. Avoid power struggles, because if it's something small and you can pick your battles and minimize your attention to that behavior, but then but if you make it bigger than it is, or you engage in a power struggle back and forth, oftentimes, oftentimes it'll lead to a greater behavior escalation. So if you just, let this or that slide, then it's done, happens and it's done, then let that go, instead of doing that back and forth, and which could lead to something greater. Um, Try to not to bombard the person with too many people giving directions. We talked about earlier how chaotic environments can often lead to behavior escalation. So, if a person hears like too many people talking at them at the same time, that could become frustrating. That could immediately, trigger those senses that, oh my goodness, it could trigger a fight or flight response, and oftentimes you'll probably get the fight response. So we want to make sure that, if you're able to, just have one person talk to them to see what's going on, and if need be, switch out. And because a different person coming from a different perspective might be helpful to that person. And we want to make sure that we're not disregarding any attempts at what the person trying to communicate. Look at all those cues. What are they trying to tell you? What's going on with them? Look at those, possibly those early warning signs that we could have missed. After the challenging behavior occurs, we want to offer that time and space, because the person may need time to gather themselves. But if you think about it, and you're just in this situation with that person, you might need that time and space yourself. You may need to go take a deep breath or get a drink or something like that. You may need to just to step away. So give that person some time and space. Don't we want to make sure that we're not making them get back to activities right away. Making sure that they're able to step away and be alone with themselves, or do something that is, sometimes completely mindless, just to get their mind off of what just happened. Even though we're giving that time and space, we also want to make sure that we touch base with that person. We're not gonna hover, but we're gonna just touch base. We're gonna see if they need anything. Do they need something to drink? Are they hungry? Do they maybe need like a change of clothing? Are they did they get all sweaty from the situation? You know, did something happen? Were they displaying any self-injurious behaviors? Do they need you to help, clean up their something that occurred? And then also we can do is we can reflect. We need to reflect. Is there anything that stands out in your mind? Is there anything that I could have done, that I did to escalate the situation? Or is there anything that I could have done to de-escalate the situation? Is there something I could have done differently to support the person? Could I have given them a different task, or could I have offered them a different activity? Reflect on what happened during the situation, and think of any of those things that you could have done differently. Reassure the person. Let them know, that you care about them still, that, if they're a loved one, let them know that you love them. Things like this happen. You know, let them know that you appreciate them. Um, if you think about it, uh, the old adage and that old saying, you always hurt the one you love the most. Same thing happens with people with disabilities. The person that they're closest with, um, they often hurt that person the most. They often lash out at that person the most. Let them know, show them that you're going to come back and be there for them, because oftentimes people who have uh, people with disabilities oftentimes are not lucky to have their families in their lives as much. A lot of the people that I work with do not have family support, so they rely on staff. And if staff are if something happens where staff, if they get upset with staff, um they want to know that the staff are going to come back and be there for them. Provide support to help them get back to baseline. See what they need, and always as much as you possibly can, be patient. Be patient with the person. This is a learning experience for everyone. A few things to remember when working with people who display challenging behaviors. Don't take it personally. It isn't necessarily about you. They're not necessarily angry at you. They're not necessarily, it's not necessarily directed towards you, even though it feels like it in the moment. You're the person there. You're the person there who is going to get the brunt of whatever's going on. But you're also the person there who's going to be there to support them. So don't take that behavior personally. Remember that the behaviors are challenging. The person is not. At that moment, at the time of behavior, they're struggling. They're having a difficult time, but that's not who they are. Their behavior is not who they are. De-escalate first. You want to make sure that we're trying to, calm the situation as much as we possibly can, and then we'll problem solve later. We'll try to figure out what's going on later. We'll try to figure out, we'll see if there's things that we need to do to better support that person, but that behavior is not the time. Sometimes you might not be able to see it, but there, like we talked about earlier, there's always a reason for that behavior to be occurring. Lastly, have patience and empathy. Yes, you are in this situation, but we also need to remember, just imagine what that person is going through at that time as well. They're going through just as much, if not more, than you're going through at that time. Thank you.
Awesome. Thank you so much, Allison. Did anyone have any questions? I know one person wrote in the chat box, I'm so thankful. Can we reach out to you for help and guidance? Are you going to be, do you offer any Zoom support or anything for families or or people with disabilities?
I don't presently, but I mean, I'm always willing to talk to people. I'm like I said, I'm in the process of getting my degree, finishing up my degree. I just have to take my comprehensives, and then I'll be able to start getting my limited permit in New York. So, but I'm always willing to talk to people if they have any questions. I believe you have my personal email address, so if they wanted to reach out, they could. But yeah, I'm always willing to talk to people.
Awesome. Did anyone else have any questions for Allison? Awesome. We have lots of thank yous in the chat and people saying they have to go, but if there are any questions, they'll come back and look at them. And thank you for all the valuable information.
Thanks.
Awesome. Thank you so much, everyone. Have a great night.
Have a good one. Thank you. Bye.